Hi, this is Mike Rush, your host of Southern Oregon Business Page, and today I have Dr. Joanna Carter with me, and she's from Insight Vision Therapy, which is, it's not like your typical eye place where you go in and you get an exam and you get glasses. This is a totally different type of business, and so I have Joanna here to tell us what she does here. So Joanna, what does Insight Vision Therapy do?
Yeah, so at our office, we do take a different approach to, what you typically see at an eye doctor office. And,
Right.
Most offices, you're going to go in and you're going to get an eye checkup and, like you said, get glasses.
Right.
Here, we look at more of what's going on behind the scenes with the visual system. So we're looking at not only can this eye see and can this eye see, we know that vision is more than just seeing 20/20. So we are looking at how well can the eyes shift focus from near to far, and how well do the eyes point in and out together, and how well do the eyes move accurately, which can affect the ability to read, to play sports, different things like that.
Right, that's what I was seeing on your page when I was looking at that is I didn't realize that your eye, I know you use your eyes to read, but when you're reading something and maybe you don't understand what you read, and that could be something to do with not just, even if you have 20/20 vision.
Correct.
That there could be a problem with how you explain how that works.
Exactly.
Because I sort of understand, but obviously let's hear what you have to say.
Yeah, when it comes to reading, there's so much that has to happen just right in order to be able to read beautifully or effortlessly, like we kind of expect we should just be able to do.
Right.
First of all, you have to be able to focus your vision appropriately to the right place in space so that you can see it clearly and comfortably. And then you also need to be able to position your eyes at that right place in space. And we get a lot of patients that their eyes actually focus a little behind the page. So that can cause kind of like almost a doubling, or like words are moving on the page. And if you imagine you're trying to read and the words are bouncing around, are you going to want to do that for a long time?
Yeah, no.
No.
That's why a lot of people don't like to read.
Right, and so what we see is we get avoidance of reading. Like, I don't want to do
Yes.
that. I hate it. It's not comfortable for them. Well, of
Exactly.
course it's not comfortable. Nobody likes seeing double.
Right.
But a lot of kids don't think to say, oh, well, the words are moving, because that sounds weird. Like, they realize that that's not probably what's going on.
Yeah.
And so eye tracking is another really important part in reading as well. And when we read, we feel like our eyes just move across the page, but they actually jump across the page. And so if your eyes are jumping too far, then you might pick up the wrong part of the word. And so those are the kids that might see was for saw. And so then they,
So is that sort of like dyslexia?
well, that's what a lot of people think. So at our office, we get a lot of patients that come in with that concern. And my job is to determine if there is a visual component going on to their reading challenge.
okay, gotcha.
And if there is, then we can do something about it to make that better. Some patients with the dyslexia concern have auditory processing challenges. And so we can do some screenings and some tests to be able to determine if they need that route of therapy, either in addition or in lieu of vision therapy.
Yeah, I saw you do a really comprehensive exam. So they fill out paperwork, and then you go through what is the exam that what do you do on the exam?
So the initial exam is going to be somewhat like a regular eye exam. I am still going to check, can you see with one eye and can you see with the other eye?
Yeah.
We're still going to do that part because that's still important. But we're also going to check like the different aspects I've talked about, the near-far focusing and the eye teaming and the eye tracking. And then we're also going to check, of course, the eye health and the other traditional things that we would look at in an eye exam. So that's the first appointment. And if I have a patient that is struggling in those areas of those eye skills, then we'll have them back and we'll do more testing that looks at more of the behind the scenes visual processing. So that's going to look at how's their visual memory, how's their visual motor, like how well does their visual system direct what their hands can do.
Right.
And we'll look at several different things. We'll look at reversals. Can they recognize the difference between a stick and a ball going this way and a stick and a ball going this way? Do they realize that one makes a D and the other one makes a B? Or is that left-right awareness just not even there for them to recognize that there's a difference? And so those are things we can work on as well.
So since you don't do the normal like eye exams and you prescribe glasses, how do people? Are you getting referrals to people that come here, or people are thinking, I need, how do people find out?
How do people find out about us?
How do
Yes.
people find out about you, and how, I mean, why are they coming here? I mean, what's the reason for them coming here?
We basically have 3 different categories of patients that come and see us.
Okay.
The first category are patients that are having academic difficulties. So they're struggling in school most of the time with reading.
Okay.
And they maybe have found out through an eye doctor referral, from an occupational physical therapist referral,
I gotcha.
or other parents. That's probably the best sorts of referrals. Parents of other
Okay.
patients that they
Right.
know. And so that's the first category, is kids that are struggling in school.
Mm-hmm.
The second category are patients of any age that have an eye teaming problem. And so if we imagine these are the eyeballs, then maybe one eye is pointing in while the other one's straight. Or out,
okay.
or up, or down, or just, an eye alignment problem.
And
Or
some call that like a lazy eye? Or?
that could mean several different
Okay,
things, but
okay.
right. Or one eye that doesn't see as well as the other. So one eye sees clear and the other eye sees blurry.
Oh, I
Now, the
gotcha.
traditional therapy for that is just patching, which nobody likes patching.
Yeah.
So in our office, we take a 2-eyed approach to treatment, and we utilize our Vivid Vision technology, which is a virtual reality, to
Mm-hmm.
help encourage both eyes to work together and really work on that brain function,
Right.
working with both eyes.
Right.
The third category of patients we see are head trauma or neurologically compromised patients. So our
Okay.
stroke patients, head trauma, concussion, who, in the first few weeks after a head trauma, especially concussion, we expect we expect our patients to recover by about week 2 to 3. But if they're still having lingering symptoms like light sensitivity or dizziness with movement, or a whole host of symptoms, then it's appropriate for me to take a look at them.
Okay, I gotcha. And so you don't only do kids, but you do all age
Absolutely.
patients. Okay.
Right. There used to be a myth that if a patient had an eye turn or lazy eye issue, that they could only be corrected up until age 6.
Oh,
And
really?
that's just not at all true.
Okay.
So we do have some patients in their 20s, 30s, 40s, 60s, and 70s that are here for an eye teaming issue, and we are making good progress with them.
Oh,
So it's
okay.
exciting.
Yeah, and you have this room here, which we're going to show you in a minute, that
Yeah.
you have people do different exercises.
Yes.
And different eye-hand coordination type of things. Now, is that part of the therapy?
Yes.
Okay.
Right.
So I really want to show you this room. So what are we gonna do here?
Yeah, so in vision therapy, we work a lot with the eyes, brain, and body. So we kind of teach our patients how to move through space by kind of seeing the whole picture, what's around them, and working on the system that way. My great joy is kind of messing with people's brains, and
So she's
we're
gonna mess with my brain
yes,
today.
that's what we're going to do. Okay, so what I'm going to have you do first
Okay.
is just to get on the balance beam,
Okay.
and you are going to walk forward and then backwards again.
Okay, so just forward and back.
Yep.
So here I go. Do I put my hands out?
I have no instructions. You do what you want.
Okay. Okay, forward. And
And
I'm going
backwards.
pretty good so far. Oh, back's not as good. Oh, there we go.
All right. So not bad. You have good balance and control. You know where you are. So what I'm going to do now is just have you put on these, what I like to call crazy glasses,
Okay.
and we're going to just change up how you're seeing the world a little bit.
Okay. Well, that is sort of weird.
First of all, just carefully step onto the beam. You can
Okay.
look and see where you're going.
Okay. Whoa. That is different. Oh my gosh, that does make a difference. Look at me. I'm still walking across the beam though. I still have good vision. Okay, now backwards again?
Yes, of course.
Okay. Here we go. Oh my gosh. That does make it a little different, doesn't it?
Yeah.
Okay.
All right.
Hey.
So yeah, you survived. You
Hey, I
did well.
Okay.
So just because you did well doesn't mean we're done. So we're gonna just change things up briefly here.
She's gonna make me fall off of this beam is what she's
That's
gonna
my goal.
do. Yeah. Alright, here we go. Now really crazy vision.
Yeah, we'll see.
Okay.
All right. Get out here.
My non-hair makes it like Velcro on my head. Oh, this makes it like bendy. Like I can't even see where I'm going. What the heck? Okay, this time I'm gonna have to look. Can I look down?
I'm not telling you what you can or cannot do.
Oh my gosh, this makes it really hard.
No.
I feel like I'm
I feel like I need to spot you.
Oh I know, you do need to spot me. Oh my gosh. It's like it's curved. It feels like
Right.
it's curved
Yes.
or something. And then I can't figure out where my feet are supposed to go.
So that tells you just how much you rely on what your visual system is telling you.
Yeah.
Because you know in your brain that this is not a curved beam.
Right.
But your vision telling you that it is makes you feel like it must be.
Really, now I'm going backwards a little better than forward. That's weird. That's because I'm not looking at it, right?
Exactly. So you're using more of your whole field of view, your space.
Look how good that was.
So I want you to try going forwards again, but this
Okay.
time with your eyes up. Well, you can look down to figure out where the beam is.
Okay. Oh yeah, that's a little better.
You're still almost falling off the beam, but
I'm still still feel, you know, it feels like I'm not sure what to say, but going backwards is a lot easier. What the heck? See these glasses? These are sort of really weird looking.
So they're called prism glasses because they're thicker on one side and thinner on the other. And so
Okay.
they shift your world over to the side, but they also kind of bend things and
All right, so I need to try and go backwards again. Okay, here we go. You know what I'm doing? I'm using the camera now.
Oh, that works. Oh, you can stay centered with
Uh-huh.
Oh, cheater.
I'm cheating. I'm a cheater.
All right. So that's just one example of
That is,
the types of therapy
I
that we
cannot
do.
believe how different that makes it. That is just amazing.
Yeah.
So what are the, so we also have like trampolines and stuff like that here too, so.
Right, so like I was describing to you earlier, we have some patients that have difficulty using two eyes together. And what we find is that the more we can work with both sides of the body, that helps both sides of the brain work together, which helps both eyes work together.
Okay.
So on the trampoline, we might have patients that have difficulty really seeing with both eyes together. We get them jumping, that gives that bilateral, both sides of the body input, and all of a sudden, their brain kind of, like it has that aha
Right.
moment and both eyes are turned on, and maybe we get patients seeing in 3D for the first time.
Right.
Just by activating both sides of the body.
Okay. So if somebody wanted to check the place out, they're thinking they need to see you,
Right.
where do they come? So what's your address and?
Yeah, well, we're located at 814 East Jackson Street in Medford. We're just a block up from Buttercloud. Everybody knows where Buttercloud
Right,
is.
yeah,
Right.
yeah.
And
That's
and our website is medfordvt, as in visiontherapy.com.
Okay.
And so on the website we have information about how to schedule, insurance information, and even a link to our codes and fees, you know, all that important stuff.
Are you on Facebook as well? Do you have a Facebook page?
We
as
do.
well?
We have a Facebook and an Instagram page.
Okay. So find them on Facebook, find them on Instagram, find them on, what was that website again?
medfordvt.com.
Okay, and this is Joanna of Insight Vision Therapy. And thanks for watching. If you like an interview like this with me, just message me on Facebook and I will get it done for you. Thanks for watching.
Thank you.